Airports reinstate COVID-style health checks amid deadly Nipah virus outbreak. Bangkok, January 26, 2026. International airports across Asia have urgently reinstated medical screening protocols reminiscent of the COVID-19 pandemic following a deadly outbreak of the Nipah virus, NIV, in West Bengal, India. The move comes as health authorities in Thailand, Nepal, and Taiwan scramble to prevent the cross-border spread of the zoonotic virus, which is significantly more lethal than COVID-19, boasting a fatality rate between 40% and 75%. The Frontline defense, new airport protocols. Major travel hubs, including Bangkok's Suvarnabhumi and Mueang, as well as Nepal's Tribhuvan International, have established dedicated screening stations at jet bridges for all flights originating from high-risk regions. The COVID-style measures currently in effect include thermal scanning, rapid temperature checks for all arriving passengers to detect fever, a primary early symptom, health declaration forms, mandatory documentation of travel history and potential exposure to known infection sites, health beware cards. Travelers from risk zones are issued digital or physical cards instructing them to monitor symptoms for 21 days and providing emergency contact details for local health departments. On-site quarantine. Designated holding areas have been reactivated to isolate symptomatic travelers immediately upon landing. Why the high alert? The Nipah virus is a priority pathogen, according to the World Health Organization, WHO, because there is currently no vaccine and no specific treatment. The virus primarily spreads to humans from fruit bats or pigs, but the current outbreak in West Bengal has raised concerns due to documented human-to-human transmission within hospital settings. The experience of the 2020 pandemic allowed us to deploy this infrastructure in hours rather than weeks, stated a representative from Thailand's Civil Aviation Authority. While the number of confirmed cases remains low, the high mortality rate leaves no room for complacency. Symptoms and transmission. Health officials are urging travelers to be vigilant for a range of symptoms that can appear anywhere from 4 to 45 days after exposure. Stage common symptoms: initial fever, severe headache, muscle pain, and sore throat, advanced dizziness, drowsiness, and altered consciousness. Critical acute respiratory distress and fatal encephalitis, brain swelling. Global impact on travel. While no major flight cancellations have been announced, airlines operating direct routes between Kolkata and tourist hotspots like Phuket have intensified disinfection schedules. Ground crews are now required to wear enhanced personal protective equipment, PPE, when handling baggage from high-risk flights. Health experts emphasize that while the risk to the average traveler remains low, those visiting affected regions should avoid raw date palm sap, a known hiding spot for bat saliva, and maintain strict hand hygiene. 7 dead. 1 injured in private jet crash in Bangor. Tragic private jet crash in Bangor, Maine. 7 dead, 1 injured. Bangor, Maine. A devastating aviation accident claimed 7 lives on Sunday night when a private business jet crashed during takeoff at Bangor International Airport, BGR. The incident occurred at approximately 7:45 p.m. local time on January 25, 2026, amid a severe winter storm that has gripped the Northeast. According to the Federal Aviation Administration, FAA, the aircraft, a Bombardier Challenger 600, was carrying 8 people. Initial reports indicate that 7 passengers were killed, while 1 member of the flight crew survived with serious injuries and was rushed to a nearby hospital. Details of the incident. The flight was reportedly departing Bangor for an undisclosed destination when the accident occurred. Witnesses and emergency recordings describe a harrowing scene on the runway. Impact. The jet crashed shortly after being cleared for takeoff, coming to rest in an inverted position. Fire. A post-crash fire quickly engulfed the wreckage. First responders were on the scene in less than a minute, but the intensity of the flames and the weather made rescue efforts extremely difficult. ATC audio. Air traffic control recordings captured the chilling moment. A controller reported, "Aircraft upside down. We have a passenger aircraft upside down," roughly 45 seconds after the flight was cleared for departure. Investigation and weather factors. The National Transportation Safety Board, NTSB, and the FAA have launched a joint investigation into the cause of the crash. While a definitive cause has not been determined, investigators are expected to look closely at the role of Winter Storm Fern, which was delivering heavy snow and low visibility to the region at the time. The weather is certainly challenging, said Bangor Police Sergeant Jeremy Brock. It will continue to be a challenge for investigators as they attempt to reach and process the site. Aviation experts have noted that the Bombardier Challenger series is historically sensitive to wing icing, which can drastically reduce lift during takeoff if not properly cleared. Victims and aircraft ownership. The identities of the victims have not yet been publicly released by local authorities. Public records indicate the aircraft is registered to KTKJ Challenger LLC, a company linked to a prominent personal injury law firm based in Houston, Texas. The jet had reportedly arrived in Bangor from Houston earlier that evening. Airport status. Bangor International Airport remains closed to all traffic as of Monday morning. Airport Director Jose Saavedra stated that the facility is expected to remain shuttered until at least Wednesday at noon to allow federal investigators to complete their initial on-site work. Travelers are advised to check with their airlines for flight cancellations and rebooking options.